Hello and welcome to our next episode of Question Corner with Dr. Tara Kaur. Today we're going to be talking about biocompatibility testing of dental materials and how to do that. So I'll turn that over to you.
Fantastic. This is one of the big questions that we get, particularly since we practice a biological philosophy. We're a biological dental practice. And so it's very important for us as a part of our foundation of our philosophy to make sure that what we are placing into people's mouths and into people's bodies is not causing any harm or any damage. And so most people are not aware that there are hundreds and thousands of different dental materials that can be used. And so it's important to individualize care to make sure that if we are placing something in the mouth, that it is something your body can support and it can allow you to be healthy and well. The last thing we would want to do is take an amalgam filling out of a tooth or a silver filling out of a tooth and put something in that is equally as disruptive or causes a problem or a sensitivity. So dental materials testing is a cool little way that we can get some really good information to determine what direction we go with our dental restorations. So there's multiple different ways that you can test for dental materials. We certainly don't advocate one way over another. They're just looking at things from different perspectives. So we have a couple of props today that we're going to go through. The first way that you can test for dental materials is with a blood draw. So you can go into your general physician or any laboratory technician. You need a prescription from me, so I would obviously write the prescription. You go in, you have your blood drawn, and we will send you with a kit. There's a little pamphlet, and the lab that we use is Clifford Consulting and Research. So that's where the specimen, the blood specimen, would be sent, and that's who does the testing on it. So there's a brochure. There's also a form that is all about you that you would fill out, and that would be enclosed in the specimen container that the laboratory will collect and package and submit and send off for you. There's also like a FedEx or a mailing envelope that you can give to them as well. So it's just a simple blood draw. They don't take a lot. It's about a tube or a vial of blood. This test is very sensitive. It's an antibody test, so it tests different IgGs or Ig antibodies in the blood serum, and it will give us results that are, I don't know, like 50 pages, 100 pages
It's like
long.
175 pages.
Yeah, so it's very comprehensive, and it has pretty much every dental material you can possibly imagine. The only thing I think we were recognizing is it doesn't have bone grafting material in there yet.
And it does not have anesthetics.
Yes, and it does not have anesthetics. So there are a couple of things that it doesn't cover, but for the most part we get some really detailed and good information. So that's the first way you can go about this. We don't charge anything for the prescription, for the interpretation of the results in our office. Sometimes if we need to have a sit-down consultation, there will be a fee associated with that, but that's the exception to the rule. We don't do that need to do that a whole lot. We can usually do it over the phone.
Primarily that's me you're talking to.
Right.
So.
But you will be charged by Clifford Labs for the test, and you also will be charged to have your blood drawn. So those fees we can certainly talk to you about if you call the office and inquire about that. So the first way to test is with a blood serum draw, and that's pretty straightforward, and we get some really good information. The second way we can test is through an energetic test. And there's a lot of different ways practitioners can go about doing this. Most chiropractors, naturopaths, even homeopaths and acupuncturists will actually use some form of energetic testing. And our video blog today is not to go into what that is, so if you have questions about that, we're happy to answer that. But the big way of doing it is what's called muscle testing or applied kinesiology. That's kind of the most common way that this energetic test is completed or done. And so basically what it is we have two kits. I'll just kind of tip it so you can kind of see here. And they have little vials in there. And these vials each vial contains a different dental material. And so you can bring this kit to the practitioner, and they will actually individually test each of the materials that we routinely carry in our office that we've found to be the most biocompatible, least reactive materials that are out there for the general population. And they'll test all of this, and then they fill out a form, which is in the envelope that's in the box.
And instructions are in there as well if they have questions.
Yep. And then that form is just submitted back to us. We review it, and then if there's any questions or concerns, Carly would call and go through that with you and discuss what the results say and if there's anything we need to discuss beyond that. So again, you know, most chiropractors, naturopaths, homeopaths will be pretty familiar with this type of kit, this type of testing kit. There are also electrodermal screening practitioners, and there's medical intuitive, so there's all sorts of different ways you can have this testing completed. And again, we're certainly happy to help guide you through that if that's something that you're interested in. We also have a resource list on our website which gives some suggestions for some practitioners that do some of this as well. So I think it's a very important part of what we do here. It's certainly not required, so people don't have to have the dental materials testing done, but it is really nice information for us so that we can make informed decisions and really help you choose what is right for you and make sure we're doing that in a way that supports your body and your health.
So that's a great summary. Again, if you have any other questions, you're more than welcome to shoot us an email, smile@tarakaurdds.com. Thanks so much for tuning in. We'll see you next time.
Thanks.